Hi everyone, my name is Tess Cootie-Anders. I'm the Vice President for Strategic Communications and Marketing here at Trinity, and I'm also an alumni. I graduated in 1993. By now, you've seen Dr. Anderson's email message to all of campus about the really difficult decision we had to make as a university community to move to a more conservative scenario for reopening campus. You know, the public health indicators were just not moving in the direction that made it possible for us to be as robust in a return to campus plans as we'd originally hoped. And our guiding principle through all of this planning has been to put the health and safety of our students, our faculty, and our staff ahead of everything else. That is fundamental. We're fortunate at Trinity that we're such a strong university with such a great foundation that we can put those kinds of values first. However, it means lots of changes, and it means a lot of uncertainty as you read the email and you learn more about what the fall looks like. This is just one more place of uncertainty in a storm of uncertainty for all of us, and I'm really sorry about that. We all are. And we want you to know that we're here to answer your questions, to arrive at certainty as quickly as we can, and to provide you a little bit more information about what campus is going to look like for those who are returning, and to give you more information about what learning will look like for those who will be remote. I know you have lots of questions, and I know that there are many challenges to consider in returning to campus. And so I wanted to share with you a little bit of what the experience of being on campus will be like this fall for those of you who are making your final determinations about your return. You know, the most important thing you should know is that there are some fundamental changes to our shared commitment to protect our health and safety. And so we're kind of going to engage in a new sort of social contract together. We call it the Protect TU Health Pledge. And all of those who are choosing to be and can be on campus, either living and learning on campus or living in the community nearby and coming onto campus to learn, will be asked to sign the Protect TU Health Pledge. And, you know, essentially, as I said, it's a sort of contract, a social contract around shared behaviors. And those are wearing masks that we're all going to be wearing when we're in indoor spaces together. We're going to be observing physical distancing guidelines of 6 feet or greater, especially indoors. That Protect TU Health Pledge really is just your guidelines for a new kind of behavior while we're on campus. I know that's not the way any of us wanted to start the school year, and especially for our first-year students, as you think about your first semester at college, this won't look like the experience that I had at Trinity or any of your parents had at their universities. It's going to be fundamentally different, but this is your first experience, and you will make it incredible, I know, and you're going to do so with the help of faculty and staff who are really tripling down on creating an exceptional first-year experience for those students who are making this their new journey into a university. It's important for you also to know that we're going to be actively monitoring and managing health on campus. So the only way that we could really reopen Trinity is if we thought about it as a little town. That's part of how we got to this place, that we needed to make the size of our town a little smaller. We intend to test, to trace, do contact tracing, and treating for those students who are living on campus. And that testing and tracing will also apply to students who live off campus. So on your first day of move-in or return to Trinity, you will be scheduled to come in for mass testing. So everyone will receive a PCR viral test. Right now that looks like the nasal swab. And as I mentioned on some previous webinars, we're looking at other options for the future, but the most reliable test that we have access to with a reasonable turnaround is that PCR test. From there, we'll do surveillance testing of a percentage of our population. And because we're moving to a more de-densified university setting, all of our students will be in singles. So that means that if you should need to quarantine while you await the results of a test, or if you become positive for the virus, you would quarantine and isolate in your own room, and then the university will mobilize everything you need to come to you. That's food, that's other services, contact with your faculty, medical treatment, all of the things that you would need to be healthy and safe on campus will come to you while you're in quarantine and isolation, should that happen. And ultimately, before you return, we'd also like you to learn more about what it means to live in a town Trinity and with COVID-19. And so you'll be given some information about how to complete some online training, and it's a brief module on COVID-19 and learning more about it. And that'll be accompanied by the Protect to You Health Pledge. As you move across campus, as I said, you're going to see that your ingress and egress in and out of buildings is going to be changed. There's going to be kind of one-way walkways. Elevators are going to be restricted to no more than 2 people. And then you'll see that in your classrooms or in the library, things will be physically distanced. It's particularly important when you're in the indoors that we maintain those distances and we use masks. You'll also see that there will be occupancy limits. As we've mentioned before, just like in your community now, before you go into a business, you'll see a little sign that says this business is restricted to X number of people. You'll see that in the library, for the Bell Center, for the registrar's office. Every space on campus has been sized for safety and limits placed on the number of people that can be there at one time, accounting for the faculty and staff that would be in that room. Many people have asked questions also about, what if I have some in-person and some online classes? How will I move quickly enough back to my dorm or off campus to engage in an online class? We're creating spaces on Upper Campus where students can learn virtually for those who are living here or learning on campus, so that you will have a smooth and easy transition between an in-person class and an online class. Dining services are going to have to look a little different too, because it's really tough to wear one of these while you're eating, and so that creates a higher risk environment. So maybe has been portioned off into 2 distinct spaces that can each accommodate an appropriate number of diners at a time. These are all necessary for those of you who are going to be engaging with campus remotely and learning remotely. Dr. Denise Jones, our Vice President for Academic Affairs, is going to share a lot more information about what that experience looks like. But suffice it to say that since the spring, when we had to move rapidly to an online environment, our faculty have been engaging in some really deep thinking about how to adjust their pedagogy for an online environment. And Dr. D is going to talk more about our investments in academic technology to create a really robust synchronous learning environment, and some ways that through asynchronous tools and access to information, we're accommodating students in different time zones and different learning patterns, so that your experience this fall should look significantly different than what you experienced in the spring. Listen, despite all of this, despite all the changes and the hits and the disappointments, we can't wait to see those of you virtually or in person in the fall. You are our mission. I mean, you're why we do this, and we will rise up to meet you wherever you are. So whether that is here on campus or that's at home and you're online and we're seeing each other virtually, we've all learned how to build and make connections and relationships virtually over the last few months. And we're ready to apply those same skills to maintaining and nurturing the lifelong relationships that we all build with each other at Trinity. We will not let this virus slow us down in living our mission, which is to help students build lives of meaning and purpose. We have a lot of work to do to get the campus ready for you and to make sure that all of the right housing assignments are made to each of the cohorts that have an opportunity to live on campus. And so it's really imperative that, I know it's a quick turnaround, but if you can let us know by Wednesday at midnight what your plans are to return to campus, it would be really helpful. Since the spring, there have been hundreds of Trinity University faculty and staff working really 7 days a week to make sure that we have the best possible experience for our students, and you could help us by providing that last little bit of information as quickly as you can. We know this is not ideal. This is not the fall semester we had all hoped for, but we're here for you, and this is where being a small, highly personalized university environment makes a difference. We're here to answer your questions. Yours and parents. We understand how hard this is to make decisions about sending your student away or talking to your student about what it means to live at home and learn remotely for another semester, depending on where they are and their journey to graduation. That's a more or less difficult conversation, but we know it's tough nonetheless. We're here for you. So if you have questions, please reach out to the Nerve Center at trinity.edu and ask us any questions you have, and we'll get back to you. The other thing we'd encourage you to do is please check out the COVID-19 website. There's a veil at the top of the trinity.edu that links you to that website. It's full of lots of updated information based on our back to campus plans as they sit today. And it's also a place you should watch and monitor in the event that public health officials or other authorities in Texas make calls for us that result in us having to make any additional changes. But this is our plan. This scenario is how we intend to open, and we're all working around the clock to make it a safe and welcoming place for you, however you intend to learn. We miss you. We can't wait to see you, virtually or otherwise, and we look forward to making this the best possible semester for all of us. Be safe, be well, and we look forward to hearing from you soon.